Got brain fog from your statin? Well, this study might say maybe it's not brain fog, or maybe it's not a statin. A picture can be worth 1,000 words, and this is the picture. We'll talk about the study. It was among a lot of people in Australia. Maybe it's just that Australians don't get brain fog from statins. I don't think so. So here's the study. It was JACC, Journal of the American College of Cardiology, November 2019. The title was Effect of Statins on Memory, Cognition, and Brain Volume in the Elderly. Now, how did they do the study? What were the methods? It was a prospective observational study, 1,037 Australians, age 70 to 90 years. Neuropsychological testing was done every 2 years, and a subgroup, as in about half of them, had magnetic resonance brain hippocampal volumes. We've done those in our Bredesen and dementia patients, or cognitive decline patients. It's a very good study. Covariates, in other words, what were the things that they adjusted for? What did they look for among these folks to adjust in terms of memory? Age, gender, education, BMI, type 2 diabetes, ApoE4, whether or not they'd had a stroke, hypertension, or whether or not they smoked. The results, over 6 years, no difference. No difference with memory, no difference with global cognition, no difference with brain volume. In fact, for those where statin was initiated during the time period, it did appear to blunt the decline in memory. So again, a picture's worth 1,000 words. These were the statin users. These were the guys that had never used statins. This is global cognition. This is memory. Statin users and statin never users. They look a lot alike, don't they? So maybe it's not an issue, or at least they didn't find it in this study. Thank you for your interest. There's nothing like a community. We saw that in the Louisville event. People got together and started talking about how they've had challenges and successes in preventing their own heart attack, stroke, or chronic disease. It became very clear that you don't have to be a doc with a full-time 30-year career in preventive medicine to understand this and successfully prevent heart attack, stroke, the number one killer and disablers of people. You don't have to be a physician to prevent eye disease, kidney disease. All you have to do is think, listen, and become part of the community. Now, how do you do that? Go to the membership login on our webpage, and as you can see, you can get right in. You have to sign up if you haven't signed up already. And I've already signed up. I've already gone in. It's very simple, very easy to understand. In order to help encourage this, after the success and the positive emotion, the positive impact that we're seeing with these events, we're saying, look, we need to offer more of these services for free in order to help grow this community. So you'll see us starting to do drawings for the webinar event, the courses. We've got a book coming out in about a month. We'll be offering that. Even full-blown evaluations, providing those for free for folks that, again, help us grow the community. So if you'd like to find out what the most recent rules are for the most recent drawing, just come to the membership page. Thank you for your interest.